Welcome to my word of knowledge acquisition. Knowledge is power, health is wealth. Great minds live forever. Today's tutorial shall be on Heamaturia Laboratory Knowledge. Heamaturia is simply blood in the urine, and it's obvious once the blood really colorize the urine. It's very easy for anybody to say, there is blood in the urine, and as such a person will surely panic and visit the clinic. But generally, we need to know more about the visible blood in urine. At times, there may be blood in one's urine and it's not visible at all. So the color remains the same, it's not bloody, and at times other things that we eat could also affect the color of the urine. But all these I shall be exposing as I go into the slide, so that more knowledge is acquired and there is less fear when you see somebody who has blood in his urine, his or her urine. And also, if you also experience such, you don't really have fear. So I shall have the course outline, the outline reflecting the definition as usual, and other aspects that would help us to understand Heamaturia Laboratory Knowledge. Let's click on the like button, subscribe, click on the notification so that you are always notified. And this program, this my chosen program, continues to live forever. Heamaturia Laboratory Knowledge. We are now on that knowledge acquisition. The outline is as follows: definition, the layman view, WHO view on it, government view, site of Heamaturia, and causes of Heamaturia. The definition: Heamaturia is defined as the presence of an abnormal quantity of red blood cells in the urine. It is classified into gross hematuria when it is visible to the naked eyes, pseudo-hematuria when it is colored but no red cell, no red blood cell, and microscopic hematuria when you need the laboratory microscopy to really count the presence. Layman's view. The layman sees any red color urine as blood in the urine, hematuria, but may be ignorant of the correct term. This may, however, be pseudo-hematuria. WHO view on hematuria. The WHO sees the hematuria from the perspective of the Schistosomiasis, because that is the most prominent concern of theirs in their catalog. They see it as a tropical disease and place it under the program of to control neglected tropical diseases. A disease of poverty causing chronic illness. The prevalence is high in girls than boys aged 5 to 10 years in Southern Sudan. These are findings from studies. It is a public health issue. That is the government view generally. And referral to secondary or tertiary health institutions are encouraged when the test and the problem needs better assistance. Site of hematuria: the kidney, the urethra. If you look at it, it goes down bladder, the prostate, the urethra. And this is a very good picture of it. You can see this is the pelvis, the area where all that is filtered comes. And this is the area where the stones, the pelvic stone, if it's originating from the kidney, this is where it is. At times you find a situation where the body really moves calcium phosphate from bones area and then deposit it in this area. That is usually when there is a tumor of the parathyroid gland, the parathyroid gland around the neck.
that tumor could cause excess problem where the decalcification of calcium from the bones and then deposited as calcium phosphate around this area. This is where the kidney stones really forms. And then if you go down the pelvis, you have the urethra. After the urethra, you come to the bladder. After the bladder, the prostate is around that area, though it is not connected to the kidney pathway, the urinary tract pathway, then the urethra. When we now go on to look at the causes of hematuria, circulatory distribution, but basically the area of concentration is just the urinary tract pathway. The infection running around that area is the primary concern when it comes to suspicion of hematuria. So then there is that concern too that could be as a result of circulatory distribution, for example, chronic venous congestion and infarction. Then acute glomerulonephritis, these are problems associated with bacterial infection mainly, embolic nephritis, focal nephritis, and malignant nephrosclerosis. Tuberculosis is another problem. It's a bacterial problem of the kidney. Tumors, like I mentioned, the parathyroid tumor, even there could be tumor in any of the part earlier mentioned of the kidney, the urinary tract pathway. There could be cancer, tumor anywhere. The common cause is renal carcinoma, but papilloma of the carcinoma of the renal pelvis occasionally may cause bleeding. Renal calculus, the stone either remaining in the pelvis or passing down along the urethra. I showed you earlier. Essential hematuria is a condition in which there is hemorrhage, sometimes severe, from one kidney, but when the kidney is probably removed, no cause is found. The prostatitis or prostate stone, benign prostate hypertrophy, and then you have the bladder cystitis. The infection around the bladder is called cystitis, and the bladder stones or strictures, troubled bladder, especially when it concerns schistosoma, haematobium, and cancer. This is where I end for the time being.
Yeah, having taken care of those aspects on the slide, then we go into the laboratory diagnosis and treatment. The slide for that is next, but the preamble is why the laboratory? Why do we need the laboratory? The laboratory is very necessary to really help us prevent a chronic infection, because once the laboratory is able to, a repeated test is able to show that the infection has been treated, in case it's an infection, then that person's mind is addressed and the problem ceases. There are other reasons that are not going to be, they won't be treatments, needing any treatment at all, because the lab will confirm that what you have is not any infection at all, but more of stones, or probably what you have taken, the dyes you have taken is what you are relating out. So let us move into this slide and understand more the laboratory need, and the laboratory, the need for laboratory and the laboratory tests that is usually done, and the treatment that is usually given. The aspect of tumor and cancers are also going to be explored in the laboratory diagnosis.
The microscopy and microscopy, that is the starting point of microbiology, bacteriology investigation. The microscopy is usually in this pattern. You see the bottle. These are bottles called universal containers, where a patient is expected to pass his urine. Most time it's midstream, that is, the first part is urinated out and the middle portion is collected. But in this situation, if we are looking for the schistosome, it is advisable at times to collect the distal portion, that is the end portion of the urine, so that we can have high concentration of the egg of the schistosome. The microscopy is done using a wet preparation, putting it on slide, and examining using the ×10 or ×40 magnification. The white blood cells usually are 2 to 3. If there is infection, you expect it to be more than that. It becomes very significant to report that yes, there is a state of infection. The red blood cells, in a normal situation, when it's normal, is between 0 and 2, but immediately there is a microscopic rise in the red blood cells. You expect from 3 to 3 upward high power cells per high power feed, and that is very diagnostic of microscopic Haematuria. The casts are graded in this way: hyaline, granular, and cellular. That is when the kidney is really affected. The crystals that we spoke about that could bring about this bleeding: calcium phosphate, calcium oxalate, triple phosphate, cholesterol, and even uric acid. These cells are just these are not so important. The bacterial cells can usually scanty, but if it's serious, you may be able to see bacteria really there. And the distal part is collected for haematobium. Urinalysis can also be done. That's by using the dipstick. The dipstick is stated here. It has all these attributes, these parameters that you look for. But if there is blood, this should be positive. Blood should come out as positive, since that is what we want to see. And that is also for the microscopy. You expect, when positive, up to 3 to 4. This is the crystals that could also result in the blood coming out from our urine. These crystals, when they are formed at the kidney pelvis, the pelvic part, which are shown in the first slide, it would really cause serious bleeding because of the passage. It is very difficult even to pass. There is very painful when the patient passes, and this has to pass through the pelvis to the urethra, from the urethra to the bladder and the urethra. And around that area too, you could see some problems with the prostate. If there is a prostate stone too, it could cause bleeding out of the urine samples collected. What we have here are various crystals. Like I said, this is the shape of the uric acid, this is the calcium carbonate, this is the calcium phosphate that is usually removed from bone, especially when there is a diseased a tumor with the parathyroid gland. It functions by really removing this calcium phosphate from the bones and depositing it in the pelvic region of the kidney, which will now cause painful urination and bloody samples. Abnormal crystals in urine are so listed. This is in the case when it is Schistosomiasis, which is showing red blood. You will see the typical red blood with schistosomiasis, and even with cancer too. Once there is cancer, the blood is red, very typical. But with schistosomiasis, it is at the distal part that you see more concentration of this parasite. It is pointed. This is the spine, which is very diagnostic, and inside it is the miracidium. The miracidium will show you as it is in the inside. This is the spine that I'm talking about, and this is the miracidium trying to burst out, to come out. and very diagnostic. Go on to treatment. Treatment involves if it's bacterial infection, you do the after the culture one has gotten the required numbers of cells for that is diagnostic with the count 100,000 per mil. You count colony counts, colony forming units. That is very diagnostic. Then the antimicrobial sensitivity testing is done, and the zone of inhibition is very useful. It's saying this drug is going to be very useful in vivo. In vitro sensitivity could mean that yes, in vivo it is likely to be very, very effective against the bacteria. The drug used for schistosome is still a parasite. A prescription medication is taken for 1 or 2 days to treat Schistosomiasis. Cancers are treated with surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy, bone marrow, stem cell bone marrow, hormonal therapy. That if you like what is presented, just click the like button and subscribe. Thanks for listening. Like I earlier said, this is where you look at the culture before the sensitivity. The reporting the colony forming unit, very useful too.